This educational content is provided by Dr. Keshav Narain, a leading expert in retinal and optic nerve care at South Bay Retina. Imagine if the batteries inside your body started running out of power. Not just for a moment, but slowly, day by day, losing the energy you need to see, move, and even think clearly. But these aren't your phone's batteries. These are the tiny powerhouses inside every cell, called mitochondria. They work tirelessly to keep your body running, converting food into the energy that fuels everything you do. In mitochondrial diseases, these crucial cell batteries become damaged or stop working properly. When that happens, your cells can't get the energy they need, and the effects can be felt throughout your body. The eyes in particular are some of the hungriest organs for energy. They rely on healthy mitochondria to function well. When their energy supply drops, it can lead to serious vision problems, sometimes even before other symptoms appear. The good news is that with the right approach, we can often detect these changes early. Regular eye exams and advanced imaging can spot the warning signs, giving us a chance to protect your sight before major damage occurs. In this video, we'll dive deeper into how mitochondrial diseases affect your vision, what symptoms you should watch for, and how science-driven care and new research are helping patients live better, healthier lives. Let's get started. First, let's clear up a common misconception. When people hear vision loss, they often think it's all about the eyes themselves. Maybe you picture someone needing glasses, or an older adult developing cataracts. Most of us assume that if our vision changes, the problem must be with the surface of the eye, the lens, or the cornea. But the truth is, vision is much more complex, and sometimes the root cause is hidden far beneath what we can see in a routine eye exam. For some people, the real issue starts much deeper, inside the cells themselves, in tiny structures called mitochondria. These are often called the powerhouses of the cell, and for good reason. Mitochondria are responsible for generating the energy that every cell in your body needs to function, including the cells that make up your eyes and optic nerves. These mitochondria produce ATP. Think of it as your body's electricity, the fuel that powers every process in your cells. Without enough ATP, cells can't do their jobs properly, and this is especially true for cells that need a lot of energy. Some tissues, like your brain, your muscles, and especially your retina, demand huge amounts of energy to function well. The retina, which lines the back of your eye, is one of the most energy-hungry tissues in your entire body. It's constantly processing light and sending signals to your brain, so it relies heavily on healthy mitochondria to keep up with the demand. When mitochondria malfunction, the optic nerve and retina can't get enough power. This energy shortage means that the cells in these areas start to struggle, and over time, they may become damaged or even die off, leading to problems with your vision that can't be fixed with glasses or surgery. This can lead to symptoms like blurred vision, missing patches in your sight, sudden or gradual vision loss, and sensitivity to light. These symptoms can be confusing and frightening, especially if you've always thought of vision loss as something that only happens with age or injury. But understanding the role of mitochondria helps explain why some vision problems are much more complicated, and why protecting your cellular energy is so important for lifelong eye health. So, how do we detect these energy issues before they cause permanent damage? The answer lies in a combination of advanced technology, expert knowledge, and a personalized approach to every patient. At South Bay Retina, we believe that early detection is the key to preserving vision and quality of life, especially when it comes to complex mitochondrial and retinal disorders. At South Bay Retina, we use a high-tech, multi-step approach that goes far beyond a standard eye exam. Our clinic is equipped with some of the most sophisticated diagnostic tools available, allowing us to catch subtle changes in the retina and optic nerve long before symptoms become severe. We start with a detailed history and genetics, taking the time to understand your family background, any inherited risk factors, and your personal medical story.